A medical device can now help local patients living with pain by delivering the medications directly to your pain area. It's called an intrathecal pain pump. And with more on this is Dr. Chad Domang, a North Shore neurologist, to explain how this works. Thank you so much for joining us.
Good to see you, Liz. It's been a while. Hope you're doing well.
Yeah, you too. Nice to see you. I'm not sure if I pronounced that properly, but tell us
That's
which
okay.
type of patients would benefit from this medical pain pump.
Yeah, so this is the actual device that I'm holding in my hand. Pain pumps are basically a last-ditch effort for people with chronic pain. So I'll make that very clear to the viewers. This is not something you go to first up. These are people that have failed surgery, people with major neurologic diseases such as multiple sclerosis, rheumatologic diseases such as rheumatoid arthritis. So we're talking about people that have diffuse pain, that have failed physical therapy, surgery, injections. So this is a device that we talk about that allows us to control this pain with a safer measure of giving opioid medication.
Okay, so it really is a last resort that you would be turning to.
Yeah, so what this pump is, I would say it's everything you love about an opioid with all the stuff you don't love about it. So this device allows us to administer medications such as morphine, dilaudid, fentanyl, so some heavy type of medications. And there's a catheter that goes into the spinal fluid, so it allows us to administer the medication into the spinal fluid where the nerves live. So if you think about someone that takes a pain pill by mouth, it goes from their mouth through their stomach to their bloodstream to get to the nervous system. So this is putting the money right on top of the fire.
So is it something you come to your office and you get it done? I mean, or do you have this pain pump at home? Explain how this works if you're a patient with chronic pain.
Sure. So I always start with what people know, pacemakers, implantable devices. This is an implantable device just like any other. So we implant it right below the belt line, so it's not going to be sitting like a man's wallet, but right above it. But there's a reservoir in this pump where we can fill it with morphine, dilaudid, baclofen, bupivacaine. So it gives the patient 1/300th of the dose they take by mouth. And it's 24 hours a day. So you're no longer watching that clock, waiting for the next pill, or when that medicine wears off. And think about some of my elderly patients that have, a caretaker. They don't know how to put medicine. So this device allows that medication 24 hours a day in a very safe, efficient dose regimen where the patient no longer is burdened to that pill going into their mouth.
Okay, so now that you have showed us how it works and what it is this like something you would have to do for your entire life if you live in chronic pain?
Yeah, we put these in for people exactly just like that. Again, go to the pacemaker analogy. You get a pacemaker because your heart has failed to that level. But these patients are married to me. This is something that, I sit with patients because this is not a put it in, forget about it. They still have to come see me every 2 months. We have to fill the pump. We have to maintain it, change the medicines. There could be complications. The catheters can break. The pumps can flip. So this is a device that you really need to have a good relationship with your physician, because it isn't just a put it in, forget about it. There's a lot that goes involved with it. But in these patients we're talking about, what's their other options? They failed everything. And, you talk about these elderly patients with caretakers. It's so nice because the medicine is administered under the skin. They can't overtake their medicines. It just makes it so much easier. But again, everybody on board needs to understand the risks, the complications that go with these devices.
And lastly, is this covered by insurance?
So it is covered by insurance. Before we can do anything with the device, we do a psychological evaluation to make sure someone understands something's being put in your body. If they do well with that, then we do a trial. And for the trial, we basically do a spinal tap and we inject a little bit of the medication to give them a taste. And if they do well with it, they don't have any side effects, then we go forward with the implant. This surgery takes me about 30 minutes. You go home that day, and then they follow up in the office, and then we do refills and maintenance of the pump. But again, you're looking at a month to every 2 months with a doctor visit to maintain the pump.
Thank you so much. Some interesting stuff, and it's nice to see that people with chronic pain do have some other options. Have a great day. Thanks, Dr. Chad.
Same here. Take care, Liz.
Thanks.